Welcome to the latest edition of Obesity Updates, covering breakthroughs in the past 2 weeks, brought to you by Lucid Quest. Pfizer agreed to acquire Metsera for $47.50 per share, plus a CVR up to $22.50 per share, tied to initiation of a combo Phase 3 and 2 FDA approvals for a monthly GLP-1 monotherapy and the combo. The portfolio includes MET097I, a weekly or monthly GLP-1 currently in Phase 2, CT-388, a monthly amylin, currently in Phase 1, 2 oral GLP-1 receptor agonists nearing trials, and preclinical nutrient-stimulated hormones. An EASD late breaker is planned for MET233I, Roche Advanced CT-388, acquired from Carmot, to late-stage obesity trials, aiming to challenge Novo and Lilly and be top 3 in obesity by 2030. The primary endpoint was not specified. Prior early-stage data indicated notable weight loss, and shares rose on program momentum. In China, Xinherme, or mazdutide, became the third weekly GLP-1 for weight management after Wegovy and Mounjaro. Launched in July, it is gaining traction. Forecasts cited include 600 million renminbi contribution in 2025 and peak 3.5 billion renminbi by 2029. Market sizes and unit shares remain opaque, with notes on Wegovy sales cadence and potential generic pressure. On September 23, 2025, Eli Lilly announced a $6.5 billion API facility in Houston to manufacture small molecules, including orforglipron, which it expects to submit for obesity by year-end, regulatory region not specified. The facility is expected to be operational within about 5 years, creating 615 permanent jobs and about 4,000 construction jobs, and is part of 4 new US sites. On September 22, 2025 in Hong Kong, Ascletis reported a 28-day US Phase 1b study in 28 patients, where single-dose ASC47 plus weekly 0.5 mg semaglutide produced greater relative weight reduction versus semaglutide alone, including 56.2% at 30 mg and a pooled 31.6%. Cohorts were small. The trial was randomized, double-blind, and placebo-controlled. Muscle outcomes were not assessed. LDL-C reductions were seen at doses equal to or greater than 30 mg. Both 30 mg and 60 mg SC47 demonstrated significant target engagement to THR-beta by the measurement of SHBG. An EASD presentation described a unimolecular GLP-1R, GIPR-PPAR alpha-delta-gamma quintuple agonist showing superior weight and glycemic effects versus GLP-1 GIP or semaglutide in obese and diabetic mice. The design uses lanifibranor as the pan-PPAR payload with targeted intracellular delivery. Human trial timing was not stated. Eli Lilly terminated a planned 180-patient study of bimagrumab in obesity for strategic reasons, while a separate trial testing bimagrumab with or without Zepbound continues. FDA expectations may favor endpoints showing incremental weight loss beyond GLP-1 alone. An initial readout from the active study is targeted in 2026 per database listings. At EHMSG in Rome, a 93-patient obesity or type 2 diabetes cohort versus 45 controls showed distinct gut and oral microbiome patterns and candidate taxa biomarkers. Metagenomic stool and saliva profiling involved collaborators in Italy and Korea. This exploratory dataset aims to support diagnostics and therapy stratification. Stay ahead in obesity research, like, share, and subscribe for our updates. Visit elkiventures.com or email us at info@elkiventures.com for expert healthcare consulting.